morning, dear students. Today, in this section, we are going to understand why some women are getting menstrual cramps while others not. So, first, understand what is menstrual cramps. Menstrual cramps are otherwise called as dysmenorrhea. It's a common condition experienced by most of the women during their menstrual cycle. We know that menstrual cycle is a part of reproductive cycle. So, what is the prime reason for that cramp? It is because of the contraction of the uterus. And why this uterus is contracting? What is the purpose of that contraction? So, by contracting and relaxing the uterine wall, only it's possible to shed off the endometrial lining as part of the menses. So, for shedding off, that's why the uterus undergoes contraction and relaxation. That contraction, severe contraction, is causing pain. Okay, so we are going to have a look to the different reasons that is causing the menstrual cramps. First and the prime, very important reason is the production of prostaglandin. Then what is this prostaglandin? It is a derived lipid. It is a hormone-like substance, and it's a hormone-like substance, and it trigger the contraction of the uterus. So it is the agent that is causing this, prompting the uterus to contract. So suppose you think that the prostaglandin levels are too high, then the contraction will become too stronger and it will give too much pain it will give too much pain to that woman. And also, this prostaglandin, this substance can cause inflammation in the uterus, and also by that way also we will get pain. Okay, so that is it's the prime main reason, prostaglandins. Okay, but prostaglandin is necessary to facilitate that shedding off of the endometrial by bringing about the contraction of the uterus. Then consider the case of uterine contractions. This uterine contraction is important to expel the endometrial lining. Endometrial lining. And that is causing cramp. That's giving pain. Uh, that contractions, suppose it is too strong because of high level of prostaglandin or any other reason, it may press the nearby blood vessels. So, during the contraction and relaxation, it may sometimes press the nearby blood vessels. What type of blood vessels? They are supplying oxygen to the uterine muscle. So, as these blood vessels get pressed, the oxygen supply to the uterine muscles will shut off. It will not get any more oxygen and it cannot contract. So, that may also cause pain. As the muscle didn't get enough sufficient oxygen to bring about the contraction, then that contraction of the uterus will give pain to that woman. That's another reason. Then several abnormal means some severe cases also there, means that's not normal. If that situations continue, it may lead to a hysterectomy. Hysterectomy means the uterine removal. So that situations are endometriosis. Endometriosis, I explained. Means in depth. I explained in another video about the hysterectomy. Anyhow, just simply mention you that endometriosis is the appearance of endometrial tissues outside the uterus. That also lead to severe cramps. Then fibroids, non-cancerous growth in the uterus, that also can cause pain and heavier periods. Adenomyosis, that also is a condition, abnormal condition where the endometrial tissue appear on the uterine muscular wall inside the uterus. That also lead to painful menstruation. These are some other um, abnormal conditions that may lead to some critical situation that result that force a doctor to suggest hysterectomy to that woman. Then pelvic inflammatory disease. So many means inflammations. If some inflammations are happened to the reproductive organs, that also may cause pain. We have seen that excess amount means too much levels of prostaglandin can cause inflammation. So that are all some reasons. Then other reasons also there like the hormonal imbalance, an imbalance between estrogen and progesterone. Estrogen and progesterone also lead more intense cramps. Oh, how? What's happening here? Estrogen. Estrogen is a hormone that is lead to the synthesis or secretion of prostaglandin by the uterine wall. So the uterine wall is producing this prostaglandin hormone-like substance that is bringing about the uterine contraction. So estrogen is promoting the that the secretion of prostaglandin by the uterine lining. Then what is the role of progesterone? Progesterone is a relaxing. It relaxes the uterine muscle. Uterine muscle relax because of progesterone. So, if a balance exists between these two, there will not be too much contraction and relaxation. If a balance exists, if the balance is not there, like there is low level of progesterone, then the estrogen will prompt the secretion of too much prostaglandin, and that may bring about too intense contractions and relaxation. So, by that way, that women women get that intense menstrual cramps. So that is explaining here a hormonal imbalance also. Imbalance between estrogen and progesterone also can bring about intense cramps. Then stress also, emotional stress, that also a reason to cause the menstrual cramps by increasing the intensity of uterine contraction. If stress is there, too much stress is there for that person, intense uterine contraction may happen, and that will result in menstrual cramps. Then diet also have some role in bringing about that menstrual cramps. Like if we take too much sugar, a diet rich in sugar, caffeine, and processed food, that can contribute inflammation, and it will intensify the cramps. So food also has some role. Lack of exercise, poor sleep, that also another reason. Lack of exercise and poor sleep also can further intensify the symptoms. Then age and a menstrual history. In the case of younger women who were not given birth to a child, they will experience, it is more common for them to experience severe menstrual cramps. And as they become age and after they give birth to a child, then the cramps will decrease. So age and menstrual history also have some role. Genetics. Then if a girl's mother has a history of having severe menstrual cramps, then it's likelihood for her daughter also to experience the same thing during her menstrual cycle, or while she attained the puberty and having the periods. So genetics also have one role. Then menstrual flow. So what's the role of menstrual flow? If that woman is having a heavier menstrual flow, then that is also associated with the severe cramps, severe pain. So whenever on which all days are having heavier menstrual flow, then that days also there is chance to have severe cramps. How can we manage? How can we alleviate? How can we reduce this menstrual cramps? Let's see. Um, Over the counter pain relief, so many medicines, non steroidal anti inflammatory drugs, mainly ibuprofen, is usually advised for those who have this severe menstrual cramps to reduce the production of prostaglandin. prostaglandin. So what this ibuprofen is doing, it reduces the level of prostaglandin. We understood that as the level of prostaglandin is low, then the uterine contractions will reduce, and that itself bring about a low, means, or it will relieve that pain. Heat therapy by applying a hot bag over the lower abdomen, that also can give that it will relax the muscles and reduce the cramping. That's another main say it's not a it's a best adaptable method to relieve from the menstrual cramps. Regular exercise, those who are doing physical activity, by in those persons their blood flow is high, and that lead to reduce the severity of cramps. Dietary adjustment, I already told you, don't take too much sugar, caffeine, alcohol, fatty foods during the menstrual time. So that also will help to reduce the cramps. Then hydration, have enough, drink plenty of water, that also can prevent bloating. Then certain therapies also of those persons who cannot bear that menstrual cramps, they can undergo so many treatments like acupuncture, acupressure, and food supplements like omega-3 fatty acids to alleviate the symptoms. Certain birth control medicines, like synthetic hormones, mainly estrogen and progesterone, who are taking, is not that much advisable. Uh, by taking the synthetic hormones like estrogen and progesterone, that means it is preventing or delaying ovulation. As ovulation will not happen, it will affect, it will cause change in the periods, and that by that way it decrease the severity of cramps. That is, from my point of view, it is not that much advisable. Anyway, that's also another method to to reduce, to get a relief from that menstrual cramps. So by this way, hope that you got an idea about menstrual cramps, why this is happening to some women only. So those who were having means adequate level of prostaglandin, good balance between estrogen and progesterone, and all the other things that we discuss here, they will have uh, a mild menstrual cramp. For others, the case will be means the other one, they may face intense menstrual cramps. So by this, I am going to wind up this section. Thank you.
I'm an icon, man. Damn, my girl about a 10. I should fuck her in the Benz.